Hi, welcome to our Menopause and Me video series where we bring you the contributors to our very successful Menopause and Me webinar which we hosted as part of World Menopause Day in October 2021. We hope that each of the 5 videos will support you in accessing the information you need at this time. My name is Maureen Kelly and I'm a Senior Health Promotion Officer in the Midwest Community Healthcare. I invite you to watch each video as you search for support, affirmation and answers to your own individual perimenopause or menopause journey. I wish to introduce you to our second video in our Menopause and Me individual video series, brought to you by Charlene Hyland, a physiotherapist specialising in women's health. Charlene's goal is to empower women during menopause with the importance of pelvic floor exercises, physical activity and looking after ourselves. I hope you find some reassurances and answers to your questions here.
Good evening, ladies. My name is Charlene Hyland. I'm a women's health physiotherapist working in Nina General Hospital. I'm delighted to be here tonight on behalf of a group of women's health physios in the Midwest to speak to you about the role of women's health physiotherapy in menopause. The contents that we are going to discuss is what exactly is a women's health physio? Before tonight, a lot of you may not even have been aware that we existed. We're then going to look at menopause and in particular the hormonal changes and the effect of this on some symptoms that you may experience. We will discuss symptom management, when to see a women's health physiotherapist, how you can control the controllables, and then we'll finish off by looking at bone health and the protective role of exercise, in particular pelvic floor exercises. We all know that urinary incontinence can affect up to 1 in 3 women. Just because something is very common does not mean it's normal and does not mean that you have to live with it. So the role of a women's health physiotherapist. We are a group of physiotherapists who have undergone postgraduate training in the area of obstetrics and gynecology. We treat women throughout the lifespan, from antenatal to postnatal, right through to our elderly patients with incontinence. Some of the conditions that we treat include women with painful bladder and bowel dysfunctions, chronic pelvic pain, dyspareunia, another word for painful sex, interstitial cystitis, painful bladder syndrome, prolapse, and we also work in the maternity hospitals treating women antenatally and postnatally. A huge part of our role is to promote awareness and educate women on healthy bladder and bowel habits and on that protective role of exercise. When we think about menopause, we know that the definition for menopause is the absence of periods for greater than 12 months. However, more importantly, it's linked to the depletion of estrogen. And this is a fabulous slide that shows the levels of estrogen throughout our lifespan. So let's look at the levels of estrogen throughout the lifespan. During puberty, you see that sharp rise in estrogen. And then as we enter adolescence and our menstrual cycle begins, we have the plateauing effect of estrogen. We then see a sharp rise as some women enter into pregnancy. And the role of estrogen here is to prepare your body for pregnancy and delivery and for breastfeeding. And then after pregnancy, we get that sharp decline in estrogen levels. And then once your period starts again, you again get the fluctuations. And then we enter perimenopause. Perimenopause means around menopause and refers to the time during which your body makes the natural transition to menopause, marking the end of the reproductive years. Perimenopause typically starts from early to mid-40s and it can last up to 10 years. And if you see in our graph, again, you've got the fluctuations in the estrogen levels, and that corresponds with fluctuating periods. You might find that you get your period 1 month and then it's another 2 or 3 months before you have a next period. And you may at this stage also be starting to experience some of the symptoms of menopause. What's really important, and what I'd like a lot of women to take away from tonight, especially women in their early to mid-40s, is to track your period health, okay? A fabulous women's health physio, Michelle Lyons, calls the period our 5th vital sign. It's really important. We all know our phones inside out, but we really want to know our bodies as well. And for women, to know your period health is so, so important. Then as we enter menopause, at the end of menopause, we see that depletion of estrogen. The other important hormone that I'd like to mention here is the follicle stimulating hormone. It encourages estrogen production. Its levels will start to increase in menopause in a bid to stimulate estrogen production. So what are the roles of estrogen or the function of estrogen in our body? Estrogen has a big part to play in puberty and sexual development. This name for this estrogen is estradiol, and it's the estrogen that is important for developing your reproductive system. Pubic hair, the hair under your arms, and development of your breast tissues are all thanks to estrogen. Then it has a role in the menstrual cycle. It builds the lining of the uterus in anticipation for pregnancy. If no pregnancy occurs, estrogen enables you to shed the lining of your uterus. Another huge role for estrogen, as estrogen is an anabolic hormone, is to build healthy bones. And it protects your bones against the loss of bone mass. And this is something we'll talk about when we look at the bone health. As estrogen is an anabolic hormone, it also is important for muscle, tendon, and ligament health. And again, I would often have chats with musculoskeletal physios as to why women in mid to late 40s and early 50s are presenting with bilateral lower limb tendinopathies. And that's a huge role is that depletion of estrogen. Did you know also that estrogen plays a major role in our heart health? This helpful hormone helps keep the vessels healthy and pliant and controls our cholesterol. Finally, estrogen boosts our mood. It boosts the production of serotonin, and that is a chemical that will help balance our mood. So this leads us on to some of those common symptoms that you may experience. Symptoms such as depression, anxiety, memory loss, otherwise known as brain fog, headaches. And again, if we look back on that previous slide on the role of estrogen and the production of serotonin, we can see why it might lead to symptoms like so. And the other symptoms are hot flushes, increased weight gain, joint pain, and the night sweats. And then if we look at the two circles, we've got urological symptoms and vaginal symptoms. I'm going to focus on how physiotherapy can help with some of these symptoms. So the urological symptoms got to do with the urinary tract and the bladder. You can get urgency, frequency, dysuria, pain when passing urine, and incontinence. In terms of vaginal symptoms, you often experience vaginal dryness, which can contribute to urinary tract infections. You may have itching, atrophy, tinning of the muscles in the pelvic floor, and again, dyspareunia or painful sex syndrome. So next slide, we are going to focus on symptom management, and we're looking at those symptoms of urgency and frequency. And this is a significant, women's health physios have a significant role in helping women to manage and improve these symptoms. So urinary frequency is defined as going to the toilet more than 7 times during the day and more than once at night. And what we would say is when we have women who present with conditions like this, it can be very limiting, because if you're at work, it's really hard and you have to get up really frequently to go to the toilet. What we start with is we start with getting you to fill in a bladder diary. This is really important as it enables us to look at your fluid intake and your output. It tells us a lot about how the kidneys are functioning, and really importantly, it helps us to see that you are, getting good amount of fluid into your diet, because oftentimes if you're constantly going to the toilet, you might think of cutting back on your fluid intake, but you should not do this. We recommend you take 1.5 litres of fluid a day. Things that we might recommend you cutting back on include caffeine and tea and Coke. These are all bladder irritants. So as part of our role, we will educate and advise you on how to manage the frequency. The other thing that we will look at is your bowel health. And remember, an empty rectum makes a happy bowel, and a happy bowel makes a happy bladder. So I always describe it to women as you've got your pelvic floor and muscles, and then sitting on top of the pelvic floor, you've got your bladder, your uterus, And at the back, you've got your bowel. And if you're somebody who suffers a lot with constipation and your bowel quite full, that's going to put pressure on the uterus, onto the bladder, and that in itself will contribute to some frequency. We then mentioned urinary incontinence. And again, 1 in 3. This may have been something that you've had since you've given birth and you've just got on with it. But it's really, really important that you seek help and see a women's health physiotherapist. If you were somebody, in this slide, I've divided urinary incontinence into stress and urge incontinence. There are other types of incontinence, but for this presentation, we'll focus on stress and urge incontinence. Stress urinary incontinence is that sudden urge, is when you need to go to the toilet on any physical exertion or increased intra-abdominal pressure, like when you cough or sneeze and you might have a little leak. If you're somebody who purely just has that stress incontinence, so you leak when you cough or sneeze, or you're out for a walk and you're, walking very briskly and you get the leak, then pelvic floor muscle exercise is that gold standard treatment. It has been recommended in the NICE guidelines on the management of urinary incontinence. And the exercise prescription, it would be that you do your pelvic floor exercises 3 times a day and 10 repetitions. We also teach the NAC, which is a faster contraction, and it works on the timing of the pelvic floor muscles. However, as we often see as women's health physios, sometimes it's not as clear cut as somebody just having stress incontinence. So you do benefit from that review by a women's health physio if there are other things going on, because as part of our treatment, we can assess the pelvic floor muscles internally by palpation, digital palpation, and we can feel what is going on. Are your pelvic muscles very, very weak, in which case you would benefit from these exercises? Or on the other hand, have you got a lot of overactivity, really tight and painful pelvic floor muscles that are just not contracting and relaxing optimally, in which case you might need other forms of treatment before we would go down the exercise prescription route. Then if we look at urge incontinency, urge urinary incontinence, this is when the bladder muscles squeeze incorrectly or lose the ability to relax. And you're getting that constant urge to go to the toilet, okay? That may be accompanied by frequency. Again, here our role is to look at the bladder retraining. We will give you advice to stop going to the toilet just in case. And positioning on the toilet. A lot of women, we're very busy. It's our nature to be rushing around. We don't maybe stop and sit on the toilet correctly, and maybe if you're in work, you're not comfortable using, sitting completely on the toilet seat, but this is something we do not recommend. You need to be seated to relax everything, to relax your pelvic floor, to allow that passing of urine. And this is particularly important, your positioning on the toilet, for your bowel health as well. And we mentioned earlier that all is linked. So these are conditions that I don't want you to suffer in silence with. You can get a referral from your GP and be referred to a women's health physiotherapist. I have also linked at the back the ISCP, where they have a list of chartered physiotherapists who specialise in women's health. Okay. The really good news is that if it's stress urinary incontinence alone, research has found that up to 74% of women will show improvement after pelvic floor muscle training. So now I just want to take a little break and get you all engaged in activating your pelvic floor muscles. So if we look at the diagram here, we see our pelvis is a basin-shaped ring of bones, and sitting at the bottom of our pelvis is our pelvic floor muscles, okay? And if you look at the other diagram where we have the diaphragm and the core muscles shown, I teach the patients, if you think of a can of Coke, you think of your abdominal pelvic canister, okay? So your pelvic floor is the base of the can. Sitting at the top, you have your diaphragm, and then the abdominal or your core muscles are wrapping around. So they are the cylinder, and everything needs to be working optimally. When we take a breath in, our diaphragm relaxes, and that relaxes our pelvic floor. And it's very important that after we contract our pelvic floor, we tighten our pelvic floor, that we allow everything to relax. So if you think of that nice breath in, pop your hand on your tummy. As you breathe in, you'll feel your tummy muscles rise into your hand. Diaphragm is relaxing, your pelvic floor is relaxing. Now I want you to take a breath out, and as you breathe out, Gently squeeze the muscles around your back passage and front passage, imagining you're trying to stop yourself passing wind, and hold. Lovely. And breathe in and relax those muscles. Fabulous. Another way, another cue I like to use, if you get your two hands and just pop your hands underneath your bottom, so your two sitting bones are on your hands. This is a nice way for women to kind of get that visual or proprioceptive feedback. You breathe in to relax your diaphragm, relaxing your pelvic floor. As you breathe out, gently squeeze the muscles around your back and front passage as if you're trying to stop wind or the flow of urine, and hold. Lovely. And breathe in to relax. And generally, I start women, holding for as long as they're able. But again, it's very individual. The exercise prescription is very individualized. But if you are managing and able to hold your contraction, you start maybe with 5-second hold, 5-second release, and you're building that up and you're aiming to get to between 8 to 10 seconds. And the important thing, as I mentioned, is that you're relaxing in between each repetition. Okay. And if there are other issues, if it's not purely stress incontinence, if you're in doubt and if you're having issues like painful sex, which we're going to come on to next, then I would definitely recommend that review with a women's health physiotherapist. Controlling the controllables. So the vaginal symptoms, the dryness, the itching, that dyspareunia or painful sex, these are symptoms that some women will suffer in silence. They'll not speak to anybody, and it can really affect your quality of life. You need to communicate. You need to talk to your partners or husbands, let them know, because there's lots that you can do to help. With urinary tract infections, making sure you're looking at your good fluid intake. Cranberry juice can be nice as a preventative as well. When we're looking at somebody who's very dry, and again, this is something that I would see quite commonly with menopausal and postmenopausal women, that they'll be very dry and sex will be painful. So you can use lubricants. Organic products are the best to use, and we always recommend a water-based lubricant, especially if you're using condoms. Lubricants that I would recommend would be the Yes lubricant or Silk. You can also discuss the use of topical estrogens with your GP. And for anybody who's not able to, or the GP is not recommending a topical estrogen, there are vaginal moisturizers that may help as well. And these are something that you can get over the counter at a pharmacy. These are all tips that might help improve that dryness, making your sex more comfortable, and also a visit to a women's health physio who can assess the muscles internally. And there are treatments that will calm muscles down and, hopefully help you get back to enjoying sex again. Okay. So I've got some references for the links as to where those lubricants are available at the back. But always as well, if you're looking at topical estrogens, you do need to discuss that with your GP. Okay. In terms of bone health, did you know that after the age of 50, we lose 1% of our leg strength per year? So this is very significant. I mentioned earlier that estrogen is that anabolic hormone. So what can we do to help? I think it's important to be aware that those niggly, Achilles tendinopathies, plantar fasciitis, these are common in menopausal women. And again, all linked to that depletion of estrogen. Again, you can go and see a physiotherapist. It can be a musculoskeletal physio. It doesn't need to be a women's health physio for these issues. But it's really important as well that you make good diet and lifestyle choices. And I know there's been a fabulous work done on nutrition, so I'm not going to go into that too much, but think about your calcium, think about your vitamin D supplements. They all help maintain bone density. Vitamin D helps with the absorption of calcium. So it's really, really important that you make good choices during perimenopause and menopause as well, ladies. And finally, the protective role of exercise. The recent guidelines from the World Health Organization in 2020 stated that we need to achieve at least 150 to 300 minutes of moderate intensity physical activity per week. And in that, this should include 2 strength training sessions involving all the major muscle groups. So this is really, really important to help maintain your bone health. And exercise has so many benefits, including helping you to sleep better, helps with weight loss, combat stress, and just generally improves your quality of life. Did you know also that 1 in 4 adults do not meet these global recommendations? So this is something that you could start with, getting out for a walk is really good. That weight bearing, getting, some weight, starting doing some gentle strength training working. And again, you can just use your own body weight, things like squats and out and about walking is also very good. But it's just so important that, this is a time in your life where you can set yourself up and optimize your health. You have probably been so busy, if you've had children running around, supporting your family throughout the years, climbing the career ladder, what I'd like you to do is just pause, invest in your health, invest in that next chapter of your life and make it a really positive, good one. Thank you very much, ladies, and I'm looking forward to questions. My final slide is references and some lovely patient-friendly resources. Thank you.
Thank you, Charlene. Great information there again, very informative and practical, and it's just wonderful to know that there's such a thing as a women's health physiotherapist, and that can be accessed to GP referrals. So that's great. Thank you, Charlene. And again, just a reminder that tonight has been recorded and that you can watch back. We'll be sending out the link to you in the next 7 to 10 days.